Now, the World Federation of Mental Health, in collaboration with the World Health Organization, has set aside October 10 every year to raise awareness on mental health issues around the world. The United Nations Information Center says 1 in 5 adults experiences mental or neurological disorder at age 60 or over. This year, 2013, the focus is on older adults who deal with problems such as dementia and depression. How can these two be overcome? Well, hello and welcome. This is 60 Minutes with me, Angela Jetumobi. I thank you for joining me on the program today. Now, if you're watching this program today, get a mirror, look in the mirror at yourself. If you're watching with somebody else, take a look at that person beside you. Do you think you are normal? Today, my host, a mental health specialist, a medical doctor, says we all need to look in the mirror to assess whether or not we have mental health issues. How can we teach people, you and I, to recognize these mental health problems? And is it true that even if we recognize these problems, our recognition of these symptoms won't enable us to seek help because of the stigma attached to mental health issues? Join me after the break. Dr. Obialor Chimaroke is my host today. We're talking mental issues as the world celebrates World Mental Health Day on October 10 this year, 2013. Welcome back. Welcome, Dr. Obialor. Thank you very much for coming on the program today.
Thank you for having me, Angela.
Right. I said in my introduction that we need to learn how to recognize mental health issues to see if we're normal or not. And that even if we recognize these symptoms, it won't enable us to seek help because there is a certain stigma attached to mental health problems.
Yes.
Would that be right?
Your statement would be right, but the terms that you use to make your point does emphasize the stigma that attached today to mental health issues.
Right.
You use the term normal to describe someone as they assess themselves to find out that if they are normal.
Yes.
And akin to the next thing, if they're not normal, maybe they're abnormal.
Right.
But the question now would be to also assess the community and the individuals around them. And the next thing is a tag of abnormal being given to someone else. And that's the beginning of stigma. Right. That's the beginning of the problem. Because in practice and while observing society, you find out that once that tag is placed on someone, the person will end up being prevented from participating fully in community or society.
Is that a major reason why nobody wants to admit that they have mental health issues?
That is part of it, but it would be a big part of it, I would admit, but there are other associated issues.
Right.
But that term of abnormality associated with mental health is not right.
It's not right.
This is not right.
So what would be the correct way? Because, you know, you go on the streets and you hear people saying, that man is mad. For instance, you see someone stark naked. He has hair like dreadlocks, the way we all imagine a madman to be. And then you say, so what term do we use to describe such a person?
When using the terms, we are finding terms that are helpful.
Right.
That would help assist the individual to accept the problem and seek attention. Because once the label comes on them, it's one that people find hard to shake off.
It's not my portion.
Not my portion syndrome comes in there. The situation you described of the dreadlocked, unkept, naked person out there in the road is an extreme. And that's what this October 10th day is trying to prevent. That with early intervention, with recognition and early intervention, the patients, the individuals will not have to come to that extreme of ill health that would now manifest with that. And the stigma of that almost is a vicious cycle. The person would find it hard to ever come out from that level. From my practice, and most people would agree, if every part of the body was an equipment gifted by our Creator to help us achieve set goals in daily living, you find that the mind, with the brain, is a very sophisticated and sensitive equipment. You would say, when I use the term sophisticated, the term would highlight ability to achieve the best result with the least effort. That is a sophisticated equipment.
This is really interesting.
Okay.
From your description, the mind is not something tangible, like a leg.
True.
Like having a baby.
It's an aspect of the function of the brain, we agree.
Yes.
But the mind is beyond the brain in our experience of it.
Yes.
Okay. But when now you have the illness of it, okay, you have to realize that I explained to people that once you have a mind, you will have issues with your mind. The truth is that
you have your mind.
With the gift of the mind comes the responsibility to maintain it. It's like if you have any sensitive equipment, whatever equipment you have, you still have to go for service once in a while. You still have to assess it and ensure that it's at its optimum.
Yes.
But our people here in this part of the world have found that, we find that they adopt habits that don't encourage healthy mind, and with the neglect of mental health by the authorities and by the individuals, community and society at large generally, you find out that detrimental attributes, I would like to use it, or symptoms you might use, persist, are prevalent among our people. We now inculcate some mental symptoms as acceptable behavior.
Like what?
The spiritual experience. We're all men of faith, but you find out that this belief in the spirits, it's a touchy one. There is I don't see it, but most people would agree.
Do you believe in God?
I believe in God. I'm a man of faith.
Can this send madness to you spiritually?
That is people's attempt at explaining what's happening to them. But regardless of their experience, we thank God for science. Science has been able to document findings, observations, and found out how to intervene, documented interventions that bring about change. You find out people that believe that that their spirits are talking to them. Regardless of the spirits that are talking to them. You might even start off a little spiritual movement to an extent. Or you might even find people accepting it as a norm. But regardless of what that person is experiencing, there are medications that can help the person be relieved of such a burden.
So when you meet people who say they are doing me from the village, they're raping, they're armed robbers, and then when they are caught, they say, they are doing me from the village. It's my father's second wife who is doing me.
Okay, that example seems, I know what you're trying to describe, I understand it, but that example doesn't fully flesh it out. That example most likely would be someone just trying to give an excuse for his problem. But you know, there's this belief amongst our people, which is, when we open up our textbooks, our science textbook, you find it's not just prevalent in Nigeria here, that people claim that I'm being controlled from the village. Have you heard that people
I've heard that,
remote controlling me?
Remote
You now find that also in the Japanese culture, I mean, like documented outside Africa, or in other countries, that people also have experienced this sense of control, this loss of control of themselves or of their thoughts. These are cardinal symptoms of psychiatric illness, in specific schizophrenia. That is the sense of loss of control of one's mind or one's thought. You find people who are within us in the community who make these complaints, but don't attribute it to an illness, but attribute it to a diabolic scheme by people they know. But beyond Nigerian context, outside here, you will find people wherever, not just in America or the West, you find also in Japan and the Asians and all over the world,
Yes.
that this symptom has been recognized to be part of the schizophrenic condition.
Yes.
And the best part of it is that there's treatment for it. With medication,
Yes.
you find that people recover. My experience when I come across a very spiritualized patients
Yes.
who want to attribute everything to the spirit.
Yes.
First of all, I will always highlight not just labeling someone.
Right.
We want to find out function. How handicapped has this illness made the person?
Right.
You find out socially, occupationally, these experiences you've been having, are you enjoying them? Do you want to continue with them? How has it affected your life, your personal life? Are you married? Are
Yeah.
your wife, how is she handling your children? Are you contributing positively to your community?
Yes.
Are you able to get a job?
Okay, just stop there, Dr. Obialor, because if you have these symptoms, this mind thing,
Yes.
do you know?
Oh, there are different conditions in psychiatry.
Right.
And there are certain, well, among them, not evenly distributed, there are some you will have insight. It's called insight. You'll be aware of your complaints.
Right.
While concerning others, you wouldn't be aware of the symptoms. But when it comes to schizophrenia in particular,
Yes.
which seems to be the most prominent of all the psychiatric conditions,
Yes.
because of its dramatic manifestation. It's not the most common, but it's the most dramatic of it all.
And that's why that's the one people will easily notice.
No, that's the one people might notice,
Right.
but not the individual, not the patient. That one is part of its characteristics is that the person will lack insight, that is, will not be able to recognize that they are suffering from it, which is a double handicap, you would agree. Because in most other ones, those other people will seek some form of treatment.
Yes.
And most of the time, once they make such cries, even if they don't come to the psychiatric hospital, that's concerning other conditions apart from schizophrenia.
Yes.
You find out that communicating with people and talking about it and finding a way, once there's a will, there's some level of amelioration of the problem, of the condition.
Do we do enough psychiatry in Nigeria? Do we pay enough attention to mental health, in Nigeria?
I would say we don't do a fraction of enough. It's the efforts, it's growing, there's an improvement,
Yes.
but it's not enough, bearing in mind the population of Nigerians.
Right.
And in Lagos, which is a very cosmopolitan city, that's the most vibrant mental health facility, I think, is in Yaba
Yes.
Psychiatric Hospital here,
Yes.
and it's doing quite well. But beyond Lagos, because there are other 36 states,
Yes.
you find that there are people who are left to themselves pretty much.
Not all the states have a facility.
Or are actively being used as much as the ones in Lagos are.
Two events especially propelled me to want to speak with you today. First, the Central Bank of Nigeria's governor, Sanusi Lamido Sanusi, calling for psychiatric tests, he says, for those seeking public office. And then the governor of Lagos State, Babatunde Fashola, signing into law and recommending prescribing psychiatric tests for certain offenses, traffic offenses committed by drivers. For instance, facing oncoming traffic, what we call locally going one way.
Yeah.
So I thought, are these men being extreme, or is it really true that people need to have psychiatric tests to evaluate them under certain circumstances? Because we're all assuming that we're all normal, for want of a better word to use.
Yes. But I want to highlight that a big part of what they would have to address while trying to implement such would be the issue of stigma. You asked the question earlier, if we're practicing enough of it, enough psychiatry in Nigeria, you find out that one of the big impediments is that stigma. Most people would rather, the reason also they tend to want to spiritualize or find out the explanation apart from psychiatry is the stigma associated with the title of mental health upon someone. That is a very, the term is a strong emotion associated with psychiatric illness. I have the instance of a patient of mine whom I was treating, and he was about to get married, and he was letting me know that he had not told his fiancée that he was a psychiatric patient.
Why not?
Oh, most likely there will be some difficulties associated, and I'm sure he was just trying to prevent it. or trying to delay
Yeah.
the inevitable discussion, but it would have to come up soon enough, hopefully.
Yes.
But he was still having some difficulty on having to bring it up with his fiancée, though he was coming regularly and he was doing well on his medication. He had appreciated that his medication was quite helpful to him. But we're just highlighting the visceral response people have to this thing, because
Right.
it is not like on an individual level and as a community, we haven't really sorted out the issue of stigma. This particular patient was now keeping it from his fiancée, whom he was actually asking me if he could tell her after he was married.
Yes.
And I was, well, it's not left for me to do for him. It was a personal choice he had to make himself. But then I asked him if he would allow his sister marry someone who had a psychiatric illness.
Like
And he should-
himself.
Himself. And his response was visceral. He was like so vehement about it that there was no way he would allow that to happen.
Even though he had the same illness.
Yes. But
For
in our
him.
practice in
Yes.
here, we don't get to do so much. Our people don't appreciate psychotherapy.
Okay, so, and that brings me to my next question, because you know when you watch programs from abroad, or you read magazines, you hear about people going into therapy.
Yes.
We don't have that here, do we?
Sadly, we don't. The people that can afford it don't want it. I practiced in general practice in Nigeria here
Yes.
for over 5 years.
Yes.
And before I went into my psychiatry training, I came across business executives who, under the strain of work
Yes.
and their impaired social life, had adopted several habits that were not healthy for their mind, apart from alcohol dependence,
Right.
to impaired sleep that led them to dependence on sleep medication. And generally, when we describe that the stress of Lagos is enough factor, and we wonder how come more people don't come down with mental illness in Nigeria.
Yes.
But the stress of city life is
Yes.
taking its toll on individuals.
Right.
And when I come across these individuals, I find out that their insurance cover,
Yes.
health insurance cover their company provide for them, does not offer anything at all to address mental health. They will prefer to just come take their medication, if not even come requesting to get their sleep medication, which actually not encourages that dependence or even
On
addiction
sleep.
on sleep medications. All they will require pretty much for someone to sit them down
Yeah.
and help them resolve whatever internal conflict
Yes.
that they might be going through. But first of all, if you were to partake in that, you offer that to them, nobody will pay for it. And the hospital I was working with discouraged me spending so much time on these individuals.
Why? Because
They were not paid for it by the insurance company. So, and this is where I saw the need, and oh my God, then it comes again with them, what is very common in Nigeria, and what is very common among the non-Western countries,
Yes.
that people, it's called somatization,
Yes.
that people end up bringing up, it's not a mask of mental health,
Yes.
but mental health ends up most likely being presented as a physical problem. People
rather
always
on paper.
yeah, not just on paper. The person actually, with their own mind, trying to rationalize what they're going through. Maybe following tremendous stress, the
Yeah.
individual might come back with recurrent backache.
Yes.
Okay, backaches, or would come down with malaise or recurrent sense of ill health, and he will come to the doctor complaining of one pain on his leg or one other unresolved issue.
Yes.
While really all that the problem is
up here.
up there. The best form of healthcare
Yes.
isn't usually the most expensive one, but the most cost-effective, usually referring to health awareness programs where you enlighten the public on health issues. You cannot get enough of it. What that does is that it leaves the greater portion of the population enlightened about their health issues, so they can recognize it early. And once they can recognize it early, there can be early intervention on all arrays of medical issues, especially mental health. Because there is this association with mental health that, especially schizophrenia,
Yes.
that following a bout of mental illness, the person tends to spiral downwards, down the social ladder. If the person has an episode of psychiatric illness in his office, the grief associated with it would leave the person a bit socially withdrawn from that particular place. And if it's his workplace, he most likely will want to resign.
Yeah.
That is from the person's aspect and personal view of it. But most likely his colleagues and the people who are working with also inevitably will be uncomfortable working with him. So you will find out that it would seem inevitable that the person will end up leaving the place. And finding a job within the same sector where he had a public episode becomes more difficult. That the person might not be able to afford the best form of health. When he could afford the best form of health care, he didn't seek our help because he didn't recognize it early. And by the time he now would have come to us towards the tail end of, or the latter stage of the problem, we would have found out that he would now be categorized as a low-income earner.
All right. Join us again after the break.
I don't think there's somebody in this Nigeria who can give you that kind of prediction that this is any part of Nigeria can enjoy 4, 5, 8 hours of power. But there are so many challenges in putting up power plants. It's not just a plant, but you also have the fuel to drive the plant. Sometimes gas, and these are not dependent on you. So if you go and boast and say in the next 1 year, I'm going to give every delta or every person in my state 18, 24 hours, that is politics, because it may not happen. The gas you are hoping to use, at the end of the day, it might not be there. So we have a lot of these challenges that we're dealing with.
Welcome back. If you've just joined us, it's 60 Minutes with me, Angela Ajetumobi. On my hot seat today, Dr. Obialor Chimaroke is a medical consultant and medical director with Life Amada Health Consultancy. You know, just speaking with you now, I'm beginning to really question.
I believe everybody should question their mental health status. I think self-analysis is the bedrock of a healthy mind. We all need to assess ourselves as regularly as possible. And then someone described what, it's supposed to be a joke, but it highlights how interaction and just in-depth analysis of one's mind helps, which obviously most conversations you have with intimate people like you, where you expose yourself and help just discuss whatever you're going through, helps. It is said that a psychiatrist does, is paid to do what a good wife does for free. You know what I'm saying? But it's just pretty much ability and avenue for people to just open up and share their most intimate thoughts. And then what happens now? You come across that many people don't have that kind of relationship, sadly, even in marriage. Some people don't have that avenue where they can just share their thoughts, share their mind, share their experiences.
So everyone needs that avenue to unburden.
True. It's not even that the person you, though really if you were to meet a professional and who can help you following the tenets of science, what has been found to work for other people, and they study, help streamline it and get you to a point of resolution quicker than you're unburdening with someone that's close to you that is not a professional. But the fact is that when you're unburdened, generally, it is not the advice that the person might give you that helps as much as you appreciating the problem fully. You would see that you're given the opportunity while unburdening to
while talking, see a bigger
picture, appreciate the extent of the issue, and you might appreciate the need. You're not decide for yourself whether to continue with the program or to walk away, that this might be just too much for you. But at times people just remain in an inappropriate condition in life because they haven't appreciated the extent of it.
Does making me see a psychiatrist regularly mean that my mind is messed up, I'm mad, as the ordinary man on the street will say?
That is a belief for most people out there, which is sadly not the truth. It's like I described earlier, the equipment that the mind needs to be serviced regularly. Really you'll find that in societies where that is done, that people are more productive, even with mental illness fully recognized,
Yeah.
you find out that their function in life, both personally and occupationally, is maintained. While unlike places here where once it's established you have a mental illness, the uphill task is really, it becomes an uphill task for you to remain functional. Because all that conversation with the psychiatrist,
Yes.
the goal is really to maintain and optimize function for that individual. Your work, help you resolve whatever crisis you might be going through at work,
Yes.
or whatever crisis you might be going through at home.
Yes.
And people are going through a lot of crisis in Nigeria.
Okay, so who are those that ought to be seeing a psychiatrist? So people are watching us now.
Okay.
How do you know you're a candidate to see a mental health specialist?
Some people have recognized it on their own. Hopefully, one obviously for us it would seem because of the poor enlightenment among the
Yes.
public.
You smiled when you said some people recognize it on their own.
Yes, absolutely, because people have sought us out. But most of the time, they seek us out probably following impaired function, following
An incident.
incident. And I would have preferred it if it was recognized earlier, because the improvement would be more relevant to them. It would seem more
So
dramatic too.
if you know this thing early enough, there will be no incident, so to speak, either publicly or privately.
True. But then, when does one recognize it?
Right.
If you go to your GP, your general practitioner, the doctor, really, and you are, the truth is that we have a lot of unenlightened patients in the public. Most people really come with a preconceived idea of what their problem is as they come to the doctor. Oh my God, they will come and go like, doctor, that my malaria has come again.
Are you serious?
After that, my typhoid has come again. So
But
most
it's not
hospitals,
really typhoid.
why don't you just let the doctor practice? Let the doctor decide what the problem
Okay,
is.
so when we go into a doctor and we say we are preempting what we think we have.
Yes, because there's so many things that can cause malaise. It's called malaise, that sense of ill health.
Yes.
But once most people have it, they believe it is malaria.
Malay, that's M-A-L-A-I-S-E.
Yes, the French word, I think.
French word.
Yes.
Okay, so that feeling that all is not well, it could actually be from the mind.
Oh yes, it could also be from the mind. There are many, I think every aspect of medicine
Yes.
can lead to malaise. It's like most people will see the volumes of book we read before we are certified doctors. It's not, all those things written there is not all about malaria. You know, it's like, come on, it's like a wide array of problems out there. If people just have an open mind and trust their doctors more, the doctors, with the best interest of the patient at heart, would direct you appropriately to the right place.
Now, I want to talk about young children, teenagers, teenage girls, parents who are watching today. What is the right age to seek counseling or therapy for children, you know, teenage children? Does that make them psychiatric patients?
No. Psychiatric patients, the title.
Yes.
I believe every patient should have their ward's interest at heart.
Right.
Really, these things make a difference. They expose you to a professional.
When is it early enough to start?
There are different aspects of psychiatry.
Right.
I would like to list them out.
Right.
But I am particularly impassioned about child and adolescent psychiatry.
Right.
It is a very critical.
Who's an adolescent?
That it
Age?
should be from 6 to like 18 or so.
From
Yeah,
age 6 to 18.
Yes.
So anyone who's watching now who has children or wards 6 to 18, listen very carefully to what you want to say.
Where it is practiced appropriately, most children would come across a health care worker, make contact with a health care worker while they're in the public schools, while they're in the schools. Usually, the teachers have a large part to play to recognize children who might have problems with their development, might have problems with behavior.
Right.
Professional parents now might not have that time to have picked up certain things. And at times, when you're too close to the problem, you won't recognize it. You might always end up giving excuses for it.
For that child.
Yes.
What are the certain things that we should be looking out for, we should be picking up. Our antenna should be raised when we see certain things.
There are developmental milestones,
Right.
okay, that are established. Most parents are familiar with them, okay? But one thing everybody should have, for the love of their children,
Yes.
they should have, I don't think you need to make excuses. You should worry when you, at that stage, consider how important it is. Because at times, when the problem now becomes established or goes beyond a particular stage in life, you now, it's that issue of if you had known better.
Yes.
See, I appreciate a threatened parent, okay, though we have to be a bit tampered.
Yes.
But the truth is this, with this place in structure, the healthcare worker will come across children. There will be contact made early enough, even with children in the schools,
Yes.
with the teachers also enlightened to be able to recognize these issues. Okay, a child who might have difficulty concentrating in class, who might have difficulty. Most children can be rambunctious and or very hyper to an extent. So while a parent might go like, this is my own portion, this is how my child is, a teacher might be able to compare that child with his peers and realize that something might be off here. And there's nothing wrong coming to ask the psychiatrist to just check and confirm if everything is okay. There's this condition known as ADHD, attention deficit hyperactivity disorder.
Yes.
With age, they tend to outgrow it. But the impairment it causes at that stage, early stage, especially with schooling, might affect the individual for the rest of their life. If you don't do well in primary, nursery school, don't do well in primary 1 to 3.
Yes, the formative years.
In the formative years, really, you would tend to have a lifelong difficulty for the rest of your life concerning your education, or you just end up being an uphill task for that particular child. So the teachers have a big part to play in recognizing that. Okay, but then behavioral disorders that might be prevalent in the schools.
Right.
But everybody should just, for the love of children, be observant. Parents, teachers the most. We, as a healthcare sector, should also enlighten these caregivers. Find a way to meet them. I will be doing that.
Yes.
Meet them and enlighten them on how to note these relevant findings.
Yes.
And then to also know where to send them to.
Okay, and that's where the Child and Adolescent Center comes in.
Yes,
It's
that's
situated in Oshodi.
Oshodi. They have this beautiful, we thank God for that, really.
Yes.
Child and Adolescent Neuropsychiatric Center.
Right,
for
children and adolescents,
really.
especially.
It is the largest and the best equipped in West Africa, really.
And it's in Oshodi, in Lagos State.
In Lagos State. I've come across some people who tell me how rigorous it was to even realize that there was a place like that. There are an array of psychiatric illness that can afflict individuals of that particular age group. Okay.
Apart from ADHD.
There are seizure disorders, really. And seizure disorder is not just a simple convulsion, and convulsion on its own also has a very strong stigma.
Yes.
Associated with it.
Like epilepsy.
Epilepsy, yes. Usually also, most people that have that might have difficulty finding a spouse when the time comes or something like that, or even work, or just being ostracized in community.
Yes, because of those seizures.
Of those seizures. But then it's not just the convulsive fits that characterizes all kinds of seizures. There are seizures that will manifest with aberrant behaviors by the individual.
What do you mean aberrant behavior?
The child might go about, the individual might go about walking around, doing things.
Stoning windows and...
behaviors that are out of character, and the person will come out and say he or she doesn't remember that incident.
No recollection.
Yes. It is temporal lobe epilepsy is that type of seizure. Because we will ask that question.
Yes.
As this question, why would you say I'm a psychiatric patient? What I want to do, I'm doing it. It's all about different opinions. But when I'm meeting my patients, I highlight their function again.
Yes.
It's all about your personal, your occupational, and your function in community.
Okay. Let's talk about the stigma now. You mentioned the psychiatric hospital in Yaba.
Yes.
and it's on a major road.
Yes.
It's right in front of a major bus stop,
Yes.
Yaba bus stop. You know, even I shudder to think that I would walk in through those gates in full glare of everyone. Do you find that that's a hindrance? People don't even want to walk in there in case they're seen coming there.
I have even heard that people don't like walking on the same side of the road the hospital is on.
Right, they cross.
They cross. But
to the other side.
yes. The hospital is the state of the art, really. It is, some people have the preconceived idea that you will probably go there and find people bound in chains and all.
Yes, in straight jackets.
Not so much, no. People are treated humanely in the place, okay? And it's still a science in that the body of knowledge required to treat those people are available. Knowledge is prevalent all over the world now, really. It's not hard to have it. But then the structure in Yaba,
yes,
the people are well trained, and the individuals come out, and everybody's result oriented. That the patients come and we seek to have them achieve the life that they want to live as much as possible.
Join us again after the break.
Who knows abi better thing? Abi who no like better thing? All these fine things wey dey see so. Na money government dey take do am now. Abi, as in, it's like, excuse me, I dey pay my tax. I dey do wetin? I dey pay my tax. Say you don't pay your own tax. Have you pay your tax?
Pay your tax. It's your civic responsibility. It's your duty. It's the law.
Welcome back. My concluding moments now with Dr. Obialor Chimaroke. Now, a patient is seeking treatment for mental health, and for duration of certain number of months is attending clinics, taking medication. Will they be cured? Will there ever come a time when they will stop those medicines?
Yes. The term cured is not regularly used in practice in psychiatry.
Right.
Okay, but the experience would seem that if cure meant the resolution of symptoms and the person stopping medications,
right,
is that possible? That is possible. Usually when the condition has an early intervention. Recognized early, and intervention takes place early. Enough.
Right.
Okay. But by the time most people present in the Nigerian context now,
right,
it might have been a chronic condition now. It has been years the person has been tolerating it, living with it.
Right.
So that definition of cured
yes,
might not be achieved.
Apply.
Okay.
Right.
But in practice, you still can achieve an acceptable level of life, comfort of life, achievement, sense of achievement, and a more fulfilling experience
yes,
with their mind can be achieved following the treatment, regardless of any time they come.
Even if they come late.
Even if they come late, an acceptable level of life can be achieved for the person.
But they will continue on their medication.
But most likely they will have to, the medication might be for a long time, depending on the condition. But there's some conditions you don't need to take medication for so long. But in our practice, people might not like taking drugs that regularly. We are aware of that. For individuals that have psychiatric illness, they have to appreciate that it's a burden they might have to live with.
And you've mentioned burden a few times.
Yes.
What is this burden of mental health care?
Well, that refers to the prevalence of mental health, mental diseases in the country. And many people believe, wrongfully so, that Nigerians are not mentally ill or we don't have that burden. I think we just self-delusion to an extent. People are not being straightforward with themselves. The people that will get treated won't go and tell people that they got treated. Unlike other conditions, when you suffer from cancer or something, you're quite open about it, I survived that.
Yes.
So that helps with that belief that people don't suffer from it.
Because nobody talks about it, nobody admits it.
Yes.
And the people you would see in practice, in the clinic,
Yes.
will they be people from a certain strata of society?
It cuts across. Everybody is
From the high class to the low class to the middle class?
They might have different conditions more prevalent within their own groups. As I said, everybody has in mind we inevitably have to deal with mental issues soon enough. You intervene early, it won't be a chronic, dilapidating experience. But if you ignore it, persists and becomes chronic and a problem. But highlighting the burden, we should just assess ourselves first.
Now, in May 2013, this year, the World Health Assembly adopted a comprehensive mental health action plan up to the year 2020. This plan recognizes that social and health services must come together to provide an effective response to mental health problems. In your opinion,
Yes.
what should this response be?
More enlightenment campaigns.
Right.
People should be discussing mental health in every forum. I believe it's the most important organ in the body, or the middle aspect of medical care.
Right, the mind.
The mind. I come across different groups of people. I enlighten them with issues that will be relevant to them. Nursing mothers, they have to look out for those developmental milestones of their children.
Right.
And yes, have a high standard for their own child. Give less excuses. And so inevitably you will have to seek a professional's opinion. For adolescents of older teenagers, you'll come across that allure of substance use. It is a burden. There is a poor record-keeping culture in this part of the world. That will help people appreciate the burden really fully. But apart from discussing it,
Yes.
they need to discuss it with these records appropriately updated. So those records, whatever department, whatever level you are, keep a record of how many people have been coming down with it, and let people know how common it is in their community.
Okay. Using the Lagos State traffic law as an example, now people going one way
Yes.
and sending them for psychiatric tests. Speaking with some of those people who have been sent for tests, initially they disagreed. They thought it was a little overreaching of the state government recommending psychiatric tests.
Okay.
In your opinion, is it overreach, or must there be a screw loose somewhere for you?
Not necessarily screw loose somewhere in that term, but I believe any form of contact with a mental health professional is good for the community. I believe any form of contact. I'm sure even if the person doesn't have a problem, that interaction with the doctor would let the person get that insight on mental issues.
Step back and think again.
Yes. But would it prevent such practice of crime, or maybe I'm not sure.
Right.
But from the mental health professional's point of view, we want to see more people come to us. So we want to help.
Whichever way.
Yes. Yes. So it helps at the end of the day. Like my recommendation of discussing with it. Anybody that encounters us, encounters me anyway, you can help us discuss issues with them as much as you can.
Would you say then that a person who's going one way has a mental health issue in making decision, a rational decision?
That is yet to be established. No, but it's possible, obviously. Okay, but I guess the assessment will be the final.
What kind of questions would you ask such a person? For instance, sent to you. I'm sent to you because I've done that. What does my action tell you as a professional?
Most likely, I obviously need to calm you down first. Most of the time when they come, they are truly agitated, okay? But they need to calm down. And I reassure them that this is just a routine assessment.
Right.
And while sitting down with them, we would find out how their day was and actually find out the rationale behind the action. Why did they have to run it? Were they not aware of it? During the interaction.
When you say they're not aware of it, they're not aware that something more terrible could happen as a result of that action?
The ramification, every aspect of that action will be assessed. But truly, what we'll be seeking would just be the person's thought function, how the person reasons.
Have you found that some people really have fractured reasoning from that?
Not from my own experience.
Is mental illness, is it hereditary?
Some of it has been found to be hereditary. No, it's not. Yeah. The most dramatic aspect of schizophrenia has had some hereditary component and other conditions. But environmental factors have not been isolated from it. Someone who does not have a hereditary predisposition to it can still come down with it.
What are these environmental factors?
Lack of fulfillment in life pretty much encapsulates.
Like you don't consider that you've achieved much?
You're left to your thoughts, ruminating over it, and it not being resolved in one's mind might lead to depression, and depression, if left untreated, might further on deteriorate to further things, truly. Grief, bereavement, I mean, so...
the loss of a loved one?
Can be a major trauma. And then also, physical trauma itself, if you were to have a road traffic accident, you ended up having trauma to the head.
Right.
Your thought concussion can really, it has been known to predispose to it. So you see, it's not just the hereditary component, which society tends to always hack on, that leads to the person being ostracized and the stigma, but it shouldn't ignore the other causes of it.
Depression now, I don't know what your thinking is, but generally, even I think that depression is not quantifiable. What are the symptoms that we will look for?
All right. Depression has been described as a normal response at times to grief, okay, and loss. So it's when it becomes prolonged and then leads to loss of function. I mean, I've been hacking on function throughout this interview. Yes. But the symptoms cardinal to depression would include reduced energy. The person would remain in their room and not feel the need to want to come out, could spend days in the room, on their bed, just claiming that
don't switch on the lights.
Claiming they're weak, they don't just feel like engaging with society, okay? Then obviously, while talking with the person, you might appreciate that the person has a low mood, and this low mood is prolonged low mood, okay? And over a month duration of this low mood, for whatever reason it might be. It might not be, the person might not be able to identify a particular reason, or might identify, but that is obviously the low mood, but then low mood, reduced energy, and the person would also have sleep disturbances, okay? And when talking with the person, you might end up finding that the person might have pessimistic view of life, negative thoughts. The person might end up being, how describing it, I'm trying to find a term that will be best understood by all. Negative thoughts would include low self-esteem, hypercritical of themselves,
lacking confidence.
Lacking confidence. Also could lead have suicidal thoughts.
Right.
Okay. So.
Some of those suicides we read about in the papers could be the end result of mental illness that's been ignored.
Yes. Could be. Well, it could be most likely. Okay. But when it comes to depression, it's one of those symptoms associated with it. Though in other psychiatric illnesses too, the person might end up being predisposed to suicide for other reasons beyond suicidal thoughts.
Okay. Now, is it true that most psychiatry students or graduates end up as psychiatric patients?
Well, it hasn't been proven yet, has it? I guess that's just old wives' tales or people are uncomfortable with psychiatry in general. Yes.
Remember I asked you if your parents were happy with this, with you doing this?
Well, I guess we have a poor record of a poor record-keeping culture here.
Yeah.
If you were to keep a record of it, that wouldn't be just an assumption. They'll have to clear it out, would they? But I doubt it. We are all very sound-minded people in my practice.
At least you should be able to recognize it.
Yes.
If you
Well, I think we're the healthiest set of people in the world, really, because we assess ourselves first
Yes.
before we even assess every other person. Know thyself first.
That's all. Well, thank you very much,
You're welcome.
Dr. Obialor, for coming on 60 Minutes with me. I'm sure a lot of people will have a lot to say, and we'll pass on any messages to you.
Thank you
very much. Well, you can like 60 Minutes with Angela on Facebook. Alternatively, follow me on Twitter, Angela at 60 Minutes. You never know who I'll be spending 60 minutes with. I'm Angela Ajitumobi. I thank you for the pleasure of your company.